ActionAid, I want to call them partners in the passion of my life, fighting for the elimination of FGM. ActionAid, I knew them way back in 2005 when they were working in Baringo, and I come from across the river Marakwet. We met in East Baringo, Kana Rescue Center, when we went to meet girls who had run away from FGM. ActionAid indeed have carried the pain that I've always carried about the girl child, especially when they are running away. I feel ActionAid also feels the pain that I feel for the girls, and I appreciate the work that they do. And I look forward to collaborating with them more now that I am the chairperson of the board on the elimination of FGM, the Elimination of FGM Act that was put in place. Now ActionAid should be there to run side by side with me because we have the backing of the law. 2003, I think, is the first time I came across the world in a function in Cairo. I met Honorable Emma Bonino from the European Union. That is when I knew that it was really indeed a global issue. For then, I was just fighting against FGM in my locality, in my community. And from 2003, having become a member of parliament, then up to now, it is indeed a global, and I've had the opportunity to also sit in the panel in New York on the UN resolution against FGM. And that time, I was just sitting as a member of parliament. This time, I'm sure with the board, I would want to push it more, not just only in Kenya, but also collaborate with those within the region and the 28 countries in Africa and also across the globe. Hearing the strategies that we've had in this workshop, with the formation of the board, I expect ActionAid to see more results now, because it will not just be them alone talking about elimination of FGM. It is now also government driven, and so I expect them to get results faster than they had done before. But thanks, of course, they have already done groundbreaking where they are. Yeah. Advocacy and communities to know the adverse effects of FGM. Communities to understand how FGM impacts on their development. And when we talk of development, it encompasses the education, the health, and all that. This is what I expect that communities in my term at the helm here, they will know the dangers of FGM. And once you know that something is dangerous for you, no human being wants to hurt themselves. Yeah. Wow, yeah, of course, I said I support ActionAid. Some of the work we've been doing, the campaigns, we've been basing it on the research done by ActionAid. If you will listen in when I'm talking to communities, I'll say, look at this research done by ActionAid, it is done this. Something that it is, the research by ActionAid is backing our campaign on the elimination of FGM. And so I do support and pray that ActionAid continues to enlarge their boundaries, because right now I think you're in 7, or is it 14? If you are in 14 counties. Well, talk of counties, but you can see when we are here, we've talked about contextualizing FGM. Please go lower to the constituencies. Yeah, because a county is made up of maybe up to 9 constituencies or districts, and out of that you will find not all of them practice FGM. But if you make it into constituencies or districts, then you will really be at the venue. Yeah. Okay, more serious in terms of higher, okay? But otherwise, all FGM is serious. The northeastern part of this country, from the Tana River across to Moyale, to the northern frontier. That is where we have very bad consequences, the high consequences of FGM. In fact, the last research I saw, they posted as 97%. But still, in your own village, even if it is 1%, it is still not good. Yeah, it is still a crime.
Interacted with ActionAid ever since I can remember. ActionAid does a lot of work, especially within communities. One of the strongest components that I know that ActionAid has is a women's empowerment program. Where I come from, ActionAid is very active, and it's done a lot of work in terms of supporting women, especially women leaders and aspirants, and looking at economic empowerment of women. So I come from a region that is called Kuria, where ActionAid has an office, and I have been running an organization that seeks to abandon FGM and promote girls' education, and so we've partnered with ActionAid on several projects that seeks to empower women, campaigns against female genital mutilation, and campaigns for girl-child education, where we are running education campaigns in schools. So I would say that I enjoy a very warm and cordial relationship with ActionAid since it came to my region. I have worked around issues of FGM since I was little, also having gone through a process that I've encountered issues within my community that are FGM related. Personally, I would say that I escaped FGM by a whisker. So since I was young, I've always wanted and I've always advocated for the abandonment of FGM. Since I've been running an NGO that also focuses around issues of FGM and campaigns against FGM, you find that on a regional scale, national, regional, and global scale, I have partnered with several movements and organizations that work around FGM and women's health issues. One of them is ActionAid. Then we have the GBV Prevention Network in Uganda, and we have many other partners. For example, in UK we have Forward, we have the OCID project, we have the UK government DFID, that really support work and support organizations within countries that have high rates of FGM. So basically, in terms of FGM work, I have connections with organizations and that work to end FGM. As a member of parliament, I'm personally very happy that, for the first time we are seeing discourse around FGM very seriously. And I do hope that we are going to take this discourse and this discussion to the floor of the House. Personally, I will be lobbying and advocating and, lobbying many other women and male members of parliament to openly discuss the issue of FGM. FGM has in the past been discussed in very harsh tones, but I'm very happy that organizations are coming up and we are now looking at ways in which to bring the issue of FGM to the national platform. So even as we start the year, I'm very delighted that we are beginning to give prominence to issues of FGM, early marriage, pregnancy, and all those things that really focus around women's empowerment. So we have had bills and laws in Parliament, and most of the laws have been championed by the current chair of the anti-FGM board. That personally and with other members of Parliament, we are going to again bring attention to, and I hope that as we open the Parliament in the next week, FGM is going to dominate discussions in the House, and will be part of the team that is really pushing for issues of FGM in the floor of the House. I do. I am a supporter of Action, and I will support ActionAid in the efforts to emancipate women. I think ActionAid is doing tremendous work, in Nairobi and all over, even in rural areas where there are offices. It is felt even on the ground. So I personally, I would really wish that we continue to partner with ActionAid, and we also, seek that ActionAid, also, gets enough support that it deserves to continue, especially the work that it has started. One of it being, FGM and women's empowerment, among many other projects and programs that ActionAid does. One of the things that I love working with in collaboration and partnership with ActionAid is that we actually go into places where it takes you out of your comfort zone, to places where communities are really in need, to address the critical issues facing those communities. So for me, ActionAid is one. I say that the name ActionAid is true. They are true to their name, that they really act. They are one organization that really acts to improve the livelihoods of communities, and they act on the aid that they give communities, especially in terms of being able to empower the communities to be able to stand and fend for themselves and to understand the issues so that they're able to be champions for themselves. My global connection with the FGM issue is not very great, other than international instruments. The recognition that we do have instruments that speak to this issue, yet for whatever reason, it is not getting the kind of coverage that it needs to get. And for me, I keep looking at it and wondering why. Why is it that we have so many instruments that speak to the issue of FGM, yet it continues to be so pervasive and morphing into something that we are quite yet to understand the complexity of it. It continues to become it morphs. It's like a hydra-headed monster. You cut off one head and it grows 10, and goes underground. And so I think that even though we have international instruments that do speak to this issue, I think that we must definitely look at it more holistically, even in terms of being able to interrogate the psychology behind FGM, because for all the work that's been done around FGM, and I think it's been over 2 decades that this issue has been highlighted, yet in the 21st century, we are still discussing it, and it continues to morph, so that you find that even migrants, African migrants, when they go to developed countries, they perpetrate these crimes against women and children. They continue them even in those areas. So I think that we must be more deliberate in really trying to understand the psychology of FGM, and not just look at instruments and think that just because we have international frameworks that we borrow from and we formulate national policies. We need also at the international level to begin to interrogate the psychology of FGM. I expect that from this point on, that FGM will become a national, regional, and as an African issue, raised to a level where we can no longer speak of women's empowerment and not address FGM. And for me, it is something that must be taken seriously. Heads of state must meet about it, and we must have, I don't know if we're going to have a standalone instrument that speaks to the issue of FGM, that ensures that FGM is integrated in every developmental approach when speaking about Africa. We must make our African heads of state sit up and pay attention, because this FGM is a crisis among women, and it is confining women to miserable lives, and communities. And they must look at it as a developmental issue, because Africa is not going to develop for as long as we continue to, cutting our girls and our women. And the African woman is not going to be empowered. And for us, those of us who are empowered, we must remember that for as long as we have
women who are disempowered, we are still disempowered, you know. We're only as strong as our weakest link. And FGM is a seriously weak link, and it really breaks that bond of women's empowerment, and it makes it look like we're speaking in a vacuum, because women are living lives that are punishable at best because of FGM and the misery that it visits upon their lives. Totally. I support ActionAid 100%. And I say this, and I think, Elichwe, you know, that for me, if there is one organization that I know is a true champion of people, it is ActionAid. I support the work of ActionAid, and I think that if donors are looking for an organization that they can partner with, not just in Kenya, but around the world, it is ActionAid. I mean, you look at the work that ActionAid is doing across the world. ActionAid is doing things that actually impact the lives of people. They're not just speaking policy and talk shops and paper pushing. They're moving people from one level to another. They come into communities, they empower the communities, and they come out leaving the communities empowered, able to fend for themselves. And I think that is a true model of development. That's a true model of what aid is supposed to do. Aid is not supposed to create dependency. It's supposed to help you move to the next level, and ActionAid does that. So for me, ActionAid is the go-to organization.
I must say I was on board. It's always an experience that comes with deep feelings. It brings in passion, it brings in pain, yet it brings in the strive of wanting to do the best to ensure that FGM in this country and across the globe, and especially in Africa where the vice is completely banned, eradicated completely, not in pieces. So it just makes me feel so angered and annoyed that for years we've not been able to get through the bottom of FGM, either at the government level, at the community level, at the CSO level. And so it feels like a new beginning for me today, that we are moving to a higher level in terms of we are courageous enough to bring these women who have gone through this difficult time, yet they have become the great champions and ambassadors of anti-FGM across the globe. I think first of all, I just want to say thanks to ActionAid for thinking about this. As you know, 10 countries across the federations are working on FGM, but I think as you heard in the morning, it's bits and pieces. So I think this framework for me is going to put us together in coming up with a very holistic approach, approaches that are community sensitive, community owned. I think there are key things that I've learned from the women that have spoken, that the element of religion and really getting to the bottom of it is key to what we bring on board. I think the other bit also is getting really down to a serious media strategy, because I believe media has a critical role in terms of really helping us either to disseminate the policies, the acts that are already in place, and also to do education. I think also the framework for me is another opportunity of looking at what one of the ladies brought on board. How do we use men for the campaign so that men see the benefit of anti-FGM within them, personalizing the issues of FGM within the particular mapping that would be done. So it would be excellent to see how ActionAid can actually tweak things, in the fact that I know that women's rights are core, but this is calling us actually to bring men champions and men ambassadors in place so that we are able to address holistically. So in a bottom line for me, I'm looking at a very holistic, unified framework that would be able actually to sell to any donor, and that we would have different pillars, as the experience that we've had this morning from the joint presentation by UN. I think it would be very advantageous for us to really scrutinize further what the joint pillars would be for us. What are the critical elements of the framework that ActionAid would say this is a non-negotiable for us to call it a proper framework, but also the critical bit is us now being able to localize the same framework, so that we are not expecting all country programs to actually roll out the same interventions, but is each and every country being able to localize and contextualize what will work for them. For example, what was given with the communication strategy, and I think UN shared very well, saying when they took from Senegal and applied in Somaliland, it didn't work. And I think, to me, today has really been good, because we know what we can do and what we can't do to look to a successful programming for anti-FGM.